Hi, my name is Rachel, and for this week discussion, I will describe a group um, child and adolescent that I'm currently counseling, and I will also describe a client that who is not adequately progressing. So the group adolescent and child that I'm currently counseling comprises of 4 members who commonly have an exposure to chronic trauma in form of physical abuse, sexual assault, or emotional abuse. Most of them are still living with stress in environments that are not stable. Therefore, they have a common diagnosis of post-traumatic stress disorder (PTSD). So far, 4 counseling sessions of therapy have been conducted, and all sessions have been well attended by all the clients. So the client that I'm gonna describe who I think is not progressing well. Her name is I'm gonna call her EJ. She is an 18-year-old African American female. She has a history of panic attack, anxiety, and moodiness. After reviewing her clinical history, EJ revealed that she was in a car accident with her mother, and the mother died on the spot. She has found it difficult living with an alcoholic father, and had attempted suicide 3 times, which all failed. The client was started on Celexa 20 milligram PO daily and CBT. So far, she has done 4 sessions. However, during therapy sessions, EJ reported experiencing flashbacks. She also had distress on occasions that she would see a vehicle that looks like the mother that her mother crashed in. In the house, at the look of her mother's picture, she responds physically with an increase of heart rate and sweating. According to researchers, this is evidently an indication of poor treatment progress. The CBT therapeutic approach was used to guide treatment to help the clients improve their behavioral, social, emotional, and academic functioning in this group. This approach is highly effective in addressing some of the needs of adolescents who have ongoing stress or are still living under stressful and unfavorable environment. CBT helps the adolescents to acquire skills which foster resilience and maximize on the current strengths of the group members. Evidence-based research shows that CBT is a present-focused intervention rather than an exposure-based model. Potential traumas were discussed in the perspective of how they are linked to the current behaviors of the client and how each one understood the problems and difficulties at the present. Based on EJ's progress report, the CBT approach seems to be less effective. Therefore, as suggested by researchers, switching to exposure therapy will be best alternative for this case. There is additional information about the client that may potentially impact expected outcomes. EJ was an adopted child and the only one in the family. She was very close to her mother. The father has become a heavy alcoholic since her mother's death. However, the father caters for all her basic and educational needs. Therefore, EJ feels that there is no one within the extended family who cares about her and her father, and does not know anyone who she can trust to ask for assistance. Thank you.